morning. It's Ashley from the social media team here on the last day of HIMSS. I'm here with Dr. Rasu Shrestha, talking about everything going on at HIMSS. How are you this morning?
Great, Ashley. How are you?
I'm doing well. Have you had a good conference so far?
I'm glad it's the last day.
Yes. It's been a very exciting, very long week so far, right?
It has. I've been here from Saturday.
Me
so
too.
It's like, the long haul.
Yep. A lot of things to learn, a lot of things to remember on the way back.
Yeah, absolutely. Yeah.
So we're asking people what you're excited about. What are you curious about for the next year or so of healthcare?
Yeah, so lots of things, because 2017 is the year that I think a lot of things will actually click into place for healthcare. You said earlier that we're here at HIMSS 17 and a lot of things to learn and remember. One of the things I always talk about is how do you go to a conference like this, not just to learn, but also to unlearn.
Yes.
Right? Because I think there are a lot of things that we need to unlearn so that we can take on newer learnings and make that the new reality. So I think one of the things that I'm looking forward to in 2017 really is around the notion of the experience, right? Physician experience, and because there's so much burnout right now. We've implemented these clinical information systems in the last 10, 20 years, and technology today is more of an impediment than it is an enabler. Right? So how do we make sure that we're able to effectively address that, leveraging whether it's technology, right? Things like machine learning and AI and clinical decision support, or whether it's leveraging better design and user experience and concepts like design thinking. So really excited about that.
Cool, yeah, and we hear a lot about patient experience, but you brought up physician experience, which is something that a lot of people are saying, implementing and getting physicians to adopt the technology.
Absolutely,
is the first step.
Yes, and patient experience too, because it's a continuum.
Sure.
Right? It has to start with the physicians, but then it has to be patient-centric, and the phrase patient centricity sort of rolls off our tongues.
Sure.
But how do we make their experience world-class? They go and book a cab ride on their Uber app, and they book a restaurant appointment and no wait, and they review it on Twitter and on social media, and then they come to a healthcare institution and they wait and they struggle through complexity. So how do we make that experience better?
Absolutely, bringing it into retail healthcare. Absolutely. So what are some other breakout topics you've seen this year at HIMSS?
So one of the topics that has I think come of age is really around machine learning and artificial intelligence. Right? Today we're data rich and information poor. I can tell you that as a clinician by background. So how do we make sure that we're able to denoise the data and bring insights and make it meaningful and actionable and really allow for behavior change? Right? Because data is great. It's good to have data. And it's referred to as liquid gold. Right. And but how do you put that to use? How do you use that gold to really get the things that you need and you desire, which really is insights and behavior change?
Sure, and we're hearing, again, a lot about AI and machine learning. I think you're the first person to bring up machine learning, but I've heard it all week long, so that's great. Last question for your morning. If you wanted to recommend another social media ambassador, who would you recommend and why? A lot of people have said you.
Well, I'm humbled. Thank you to the few people who have. That's a tough question because if you look at the list of the social media ambassadors, they're there for a reason, right? And they're all such great folks. They really are. So I'm not trying to
Right, no, you don't have to play favorites.
No, but Colin Hung is someone that I'd really recommend from that list. For one particular reason, which is every Tuesday evening about 8:30 Eastern, right, is the HCLDR tweet chat, healthcare leadership tweet chat, and Colin, along with Joe Bidin, really have been putting in all of their tireless efforts. They don't get paid for this. This is not a thing that they're doing for their companies. They're doing this out of the passion of their good heart, and because of the community that it's really spurring. And I love it. Whenever I can, I try to participate in the HCLDR tweet chats and get to interact with other clinicians and entrepreneurs and patients and change makers and patient advocates. So it's awesome. So out of that list of the SMEs, all great, Colin Hung is someone that I'd absolutely recommend, at Colin_Hung.
And Colin was great. We interviewed him earlier this week. And I love the healthcare leader tweet chat and the HITSM social media tweet chat, also a great one. Thank you so much for your time. Thank you for being here, and get home safe.
Well,
That's it for us from HIMSS.